2 million people demanded an itemized bill, priced out the bill, made sure it's accurate, made sure it's fair, pushed back when it's not, we would create so much hassle for them to continue with this nonsense that I do think it would bring about a change. So I'm really trying to bring about a movement of change at the grassroots, at the level of the people who are being harmed, to protect them and also to change these norms so that we stand up and say, these norms are not okay.
Welcome to Healthcare Liberty Labs with Tiffany Ryder, where we teach you what they don't want you to know about healthcare.
Hey everyone, Tiffany Ryder here, and welcome back to the Healthcare Liberty Lab. Today's episode is going to be a little different than what we've been doing. I had the opportunity to bring you an incredibly insightful and informative conversation with the late Marshall Allen. This episode is something that I think everyone should watch. I think all patients should be exposed to this information. And I think it's life-changing. It's absolutely perspective-changing in every way. It has certainly changed the way that I view medical bills and the healthcare system in general, and even my role in the healthcare system as a patient and my role in shaping and changing the system itself. So Marshall was an investigative journalist, incredibly influential in the healthcare space, and spent over a decade at ProPublica, really exposing the exploitation of patients by the hospital industry and by insurers and the pharmaceutical industry. And his stories had real impact. They weren't about ego and headlines and readers. They were about making a difference. They sparked lawsuits and health policy changes and new laws. And they brought accountability into the healthcare space in a way that we just don't see very often. What I love about this conversation in particular is that Marshall has a way of really empowering the patient themselves. So this conversation isn't centered around the world we would like to live in theoretically, or something that our Congress people should be doing for us, or our president should be doing for us. This conversation is about what I can do today for myself to protect myself and my family. And in doing so, how that actually serves the mission of pushing back against these corporations in a way that's actually also beneficial to society. And that's a really empowering, really inspiring message. So this conversation was originally recorded in 2023, so about 9 months before we lost Marshall. And it's really Marshall at his best. I mean, it's going back and forth, sharing discrete, actual strategies on where to get started, how to look at your bills, what questions you should be asking, what words you should use when you call, different strategies you can use in small claims court, healthcare system literacy in general. But I think the most powerful thing that comes out of this conversation is it's really a message of hope. It's a message of, hey, you can do this, and here's how. And there are stories sprinkled throughout, coming from both sides, from Marshall Allen and from Andy Schoonover, the CEO of CrowdHealth, where they talk about patients they've advised or guided, and the simple strategies that those patients use to save tens of thousands of dollars, hundreds of thousands of dollars, to save their families from having to go through a bankruptcy. And it's really incredible. And I think that it will open your eyes and change your perspective and allow you to just really uncover this whole world of impact and influence that you can have as an individual that we just don't see very often. So I look forward to hearing what you thought of it. And without further ado, here is Andy Schoonover and Marshall Allen.
The promise that I make to people is that if you engage with healthcare literacy and learn some basic principles and tips, you can save hundreds or even thousands of dollars per healthcare encounter. Mm-hmm. So that's the promise I make. Now, that doesn't mean you're always going to save that much money, because you're not always being overcharged. I mean, it doesn't happen every time. But as you know, it probably happens most of the time. Yeah. And so if you can learn some basic tactics and the principles that you need to know, just get educated. So I tell people healthcare literacy is financial literacy. If you care about your money, you need to not just be looking at your bank account and your credit card statements. You need to be looking at your medical bills, and you need to be looking at where you go for healthcare, because you can save tons of money. Yeah. So it's hard to know, like how many people have actually saved, but I hear from people every day. I help people every day, and they're saving tons of money. So it's really been fun.
I love that. Well, we have 4,000 members now. I know our members have saved millions of dollars. So you can, and a lot of what we do is based very much on what you have outlined in your book. So you can add, millions of dollars to your tally of the amount saved.
That's awesome.
I read your book, and man, I wish I would have read it a year earlier than I did. I probably bore people with this story, but I think it hits a lot of people the same way it hit our family, which is, we went in for a medical treatment that our doctor said was necessary, and the health plan comes back and says, oh, it's medically unnecessary, so they deny our claim, and so we're stuck. We're like, what do we do? Yeah. And I didn't know that you could negotiate. And that's probably I know this is super simplistic, and we'll talk more about this, but like one of the things I get away from your book, maybe the most impactful to me, is you can negotiate. You have the power to negotiate. We think we're all these little, nothings in this behemoth of the healthcare system of United Healthcares and massive hospital systems. And who are we to negotiate? No, you can negotiate. And that's the number one thing I pulled away from your book. You can negotiate. We just paid an $8,000 bill because we thought we had to, or they were going to send us to collections. Right. If we had just negotiated, I mean, how important is that? And, do you have any great stories about people, saving a bunch of money by just doing simple things like negotiate?
Yeah, I do. I mean, I have a lot of those stories. And I think the thing that you're talking about, though, is that our healthcare industry has conditioned us to be very passive and to think that we're helpless and that we don't have a voice. And the truth is, this is a three-party transaction, right? If you have your medical provider, the doctor, the clinician, whoever's providing the service, you have the payer, which we are the payers, but in the industry, they talk about your insurance plan or whatever the third party is that's handling the reimbursement for the services. But then you have the patient, you have the provider, and you have the payer, the third party reimbursement entity, whatever that is. But the one who's always ignored is the patient. Yeah. And these are contractual obligations we're entering into, where we're obligated to pay amounts of money that we have not agreed to pay at the time we get the services in most cases. And so it's like this three-party transaction where only two of the parties are setting the prices and then demanding that the third party, us, the patient, just pay it. There's no other type of contractual arrangement in our consumer world where we would agree to those terms. We would never do that. And the only reason that we're behind the eight ball in healthcare is because it's our health or the health of our loved ones is dependent on agreeing to these extortion-like terms.
Yeah.
It's not fair to the patient. And so what I'm trying to do with my book and with my health literacy videos is show the patient that they do have power, they do have a voice, they have to learn to use it, and they have to be engaged. But when they learn to use their voice and when they stand up for themselves, they can save hundreds or thousands of dollars per healthcare encounter. I mean, that's the promise I make, and that delivers. In fact, some cases, it's way more than that. So I can tell you some stories. So there's a patient named Jody who I helped. She got an air ambulance bill for a trip, which air ambulances are notoriously expensive. $75,000 for a short air ambulance ride. Of course, they demanded that she pay it. Of course, they said the bill is past due, and if you don't pay it, we're going to send you to collections. All the threats that they always make. Well, in my book, I talk about using Medicare as a benchmark price. You can find the Medicare rate for air ambulances, and the Medicare rate is multiples less than what working Americans are charged. And again, in our healthcare system, you don't know this, but it's price discrimination against working Americans is the standard way our healthcare system is set up. Medicare patients pay way less. If they're over age 65 on Medicare or disabled on Medicare, they're paying, let's say they pay $100 for a service. A working person would pay $200 or $500 or $1,000 for the same service. It's not fair. And that's just the way things have worked. But if you know that, and you know that they'll accept that Medicare rate from other patients, then you can make that your benchmark for negotiating. So in this case, Jody sent them a letter, offered them 200% of Medicare. They took it. And so she knocked $65,000 off of her air ambulance price.
Wow.
So it was still a big burden. You know, $10,000 is still a lot to pay, but it wasn't the kind of burden that was going to bankrupt the family. It was the kind of burden where they could put it on a payment plan and pay it off over time. There's another guy who I just helped. In fact, I sent out a newsletter. This will be in tomorrow's newsletter. A guy named Don Jones who gets regular blood work done. And his doctor is a telehealth doctor that lives in Florida, and he lives in Ohio. So somehow LabCorp and Anthem, when they're processing these bills, keep attributing it to the site of the visit being Florida when it was a telehealth visit in Florida. So his bills are being rejected as out of network. So the first time he used my tactics in 2022, he saved about $4,000 because he was able to write a letter to Anthem and LabCorp, basically threatening to sue them in small claims court if they didn't correct the erroneous claim. Because what happens is they're shameless. I mean, they don't really care if they make mistakes on the bills. Even when you call them on the mistakes, sometimes they'll fix them and sometimes they won't. But what leverage do you have? And so I show in my book and I show in my videos how to sue in small claims court to protect yourself. And before you sue, you want to send them a 30-day warning letter that explains, if you don't correct this problem, I will sue you in small claims court. So once he sent that letter and he copied the CEO of Anthem and the CEO of LabCorp, and he copied the general counsel for both companies on the letter, within a week, they corrected it. So that was 2022. He saved about $4,000. Then a few months ago, I hear back from Don again. He goes, hey, you'll never guess, it happened again. But this time he knew the drill. He reached out to them again, got it corrected. So Don's up to $6,200 now saved.
Wow. Just
because he learned to assert himself in a strategic way, to use the leverage of small claims court, to put pressure on them, to back off, right? That's what we need them to do, back off. Because they're so accustomed and seemingly entitled to billing us whatever they want that they just keep doing it and it just keeps persisting. But when you stand up to them, what you find is they usually crumble like a house of cards because they don't have any truth in what they're doing. And so we have the moral force of what's right on our side. So you might be like intimidated, right? Oh, I'm just one person. Yeah. What can I do? How can I stand up to a big giant company like LabCorp or Anthem or whoever it is that's billing me, or a doctor, even if it's just a doctor? They went to medical school. I mean, how could they be billing me in a way that's incorrect or unfair? But never underestimate the power and the moral force of one person who's willing to stand up for themselves and tell the truth. Tell the truth and show them you are ripping me off by charging me 2 times, 5 times, 10 times. I've seen an $18,000 MRI. An MRI should be about $400.
Yeah.
I've seen a patient get hit with an $18,000 MRI in the hospital, not back down, and claim that was a fair price. Well, they didn't actually claim it was a fair price. They claimed it was their price.
Yeah, exactly. Well, I think it was, I my last podcast, I had somebody on who said that they had a CAT scan for $26,000, and I said I think a cardiac calcium score, I think is a CAT scan. I don't know if I'm maybe not correct here, but it's
like isn't it something topography, computed topography, or something like that? I don't know. What does CT stand for in a CAT scan?
Whatever that is. It's like I got one and it was $150, and I'm just like, what the heck is going on here? And we've been psyoped into thinking that we can't do anything about it. You know, somebody were to come to our door and say, I'm going to mow your lawn, and they mow your lawn and come back and give you a $5,000 bill, you'd be like, there's no way in hell I'm going to give you $5,000. Yet we've somehow been psyoped into thinking that these hospitals can charge us whatever they want, and we have no legal grounds to fight it.
Yeah, I like the psyopt comparison, where it's like being gaslighted, right?
Yeah.
It's like the American people are being gaslighted by the healthcare industry.
They are.
And we're being told that something is normal and that it's acceptable when it's deviant. It's normalized deviance. You know, this idea that deviance becomes so much the pattern of the way things operate that it becomes normalized. That's the situation we have with healthcare billing for working people in the United States. And this idea that they can charge whatever they want and get away with it. Again, in my book, I show this, and in my videos, and this is why it's important that people get educated, because once you learn just a few of these basic things, it gives you the firm moral conviction and foundation you need to stand up for yourself.
Yeah.
So there's a law in the United States called the Uniform Commercial Code, the UCC.
2-305, right? Come on.
What's that?
2-305, I think.
Are you talking about the open price term?
Open price term, yeah.
Yeah, so that's it. So the open price term is part of the Uniform Commercial Code, and people can Google it. Look it up. This law applies in every state. And what it says is, if you're not given a price up front at the time you receive a service as a consumer, it's assumed that the price will be reasonable and set in good faith.
Mm-hmm.
So in other words, if you and I, Andy, decide I'm going to mow your lawn, and then but we don't set a price, and then we get done with the lawn and I say, hey, Andy, that would be $10,000. That would be a violation of the Uniform Commercial Code. We didn't have a price up front. The law says it's supposed to be reasonable and set in good faith. So then the question is, okay, well, what's reasonable? Mm-hmm. Well, an $18,000 MRI or a $26,000 CT scan is not reasonable. In fact, I would say if a hospital or a doctor is taking the Medicare rate for a CT scan and it's, say, $500, well, is it reasonable to charge someone who's not on Medicare $1,000? I don't think so. So you could say that 2 times the Medicare rate is not reasonable. In fact, I would say it's not reasonable for me or any patient to pay more than any other patient pays for the same service in the same facility. Why would someone pay more than someone else for a particular service just because of the type of insurance that they're covered by? That makes no sense. Totally. Not reasonable. So when we know that, then we can push back on these things. And you know, they may not listen. They often don't. And so what I like to say is we have to give them the incentive that they need to be fair with us. So it's almost like disciplining a child. You know, the child isn't always going to agree with you, but you have to know more about this stuff than they do. And frankly, that's not too hard because they don't actually know all that much. They've never really thought of it from our perspective. So you have to kind of wake them up a little bit. You have to be like, hey, just FYI. Your price is 3 times the Medicare rate. Or now with hospital price transparency, you can go on hospital websites and you can see what they charge for different services to different health plans. So once you can do that, then you can say, oh, hold on, sorry, I'm getting a call here on my computer. Once you know that you can do that, well, now you know that the law is actually on your side. They can't charge you whatever you want. And so now you just have to enter into that process of contesting the bill, negotiating the bill, and trying to, again, give them that incentive that they need to hopefully be fair with you when they give you a discount on the bill.
Yeah, has fair and reasonable, or I guess it's reasonable and in good faith is the language that they use. Has any precedent been set on what fair and reasonable is? I mean, has anybody really taken this to court and battled it out?
So there's a huge precedent that was set in Colorado by the Colorado Supreme Court. And this was a super interesting case. It's a patient named Lisa French, who is a clerk for a shipping company. So this is not a high wage earner. She got an estimate for how much it would cost for her spinal surgery at a hospital in Colorado. And they told her with her insurance plan that her share would be something like $1,400 and that the overall cost of the spinal fusion was going to be about $70,000.
Jeez.
So she underwent the spinal fusion. She paid $1,000 up front. Then after the procedure was done, they came back to her and said, oops, sorry, we don't take your health plan. You're not in network with us. So now we're charging you the full charge master rates. Now, your listeners, your CrowdHealth members are way more educated than most consumers are about healthcare. So they might know what the charge master is. The charge master is the fictional, falsely inflated fantasy number that the hospital sets for all their services. It's sky high. Then they're negotiating discounts by different insurance plans off the charge master rate. So the charge master in this case was something like $300,000. So they go to this clerk, they send her a bill for $300,000, and lo and behold, of course, the poor woman couldn't pay it. And so the hospital doubles down and actually sues the woman in court for the money. The insurance plan ended up paying about $70,000. So I think they sued her for like $229,000. Again, like that's a fortune. That would bankrupt most families in America. Sure. If you got hit with a $229,000 bill, like I could never take a bill like that. Almost no one could. So the hospital is audacious, sues her, it goes to trial, and the jury finds in favor of Lisa French. And they found in favor of her because of this open price term. So this is a precedent that was set in Colorado. And they said that no price was given up front. So it was determined that it should be a reasonable price. And in this case, they determined that the reasonable price was around $70,000 or so dollars. She had already gotten, the hospital had already been paid most of it by the insurance plan. So Lisa French owed like another $400 or something like that. Well, the hospital doubled down, took it to the appeals court. The appeals court found in favor of the hospital. Then that was taken up to the Supreme Court. And in the Supreme Court's decision in Colorado, again, this is the precedent now in Colorado, they decided in favor of the jury that originally found in favor of Lisa French. They said the price wasn't given up front. The price needs to be reasonable. And so Colorado essentially outlawed unreasonable hospital prices right there with that decision.
I wonder what that 70,000 was in terms of Medicare. What is the multiple of Medicare on that?
I didn't see that in the Supreme Court decision. I only read the Supreme Court decision. I didn't read all the testimony in the case, so they might have had more on that in there. But yeah, it's still a high price, right? For a surgery like that. But anyway, the court has determined that they can't just charge whatever they want. Prices great. Need to be reasonable. Yeah. So that's then the debate. What's reasonable? What's not reasonable? And what I really hope people can do is get educated about these things before you need your healthcare services, because the ideal is, I'm really a free market person in terms of how I hope that this disruption of our healthcare industry will work out. Because there's price variation. That means that there are price gougers, and then there are different medical entities that are being fair, and they're charging fair prices. So what we need to do is identify the ones who are fair with us and give them our service, and we need to shun the hospitals or doctors or whoever insists on overcharging us. Just shun them.
Yeah, amen.
Fight them if they get hit. If they hit us with an unfair bill, we're going to fight them. But mainly, we want to avoid them in the first place and make sure that we're going to places that are going to be fair with us.
This episode brought to you by CrowdHealth. CrowdHealth helps you find awesome doctors, negotiate your bills, and fund those bills through our peer-to-peer funding platform for less. Welcome to an easier way to pay for healthcare.
The rip a little bit on, all the folks at CrowdHealth are private pay. They pay in cash. And so there's an expectation, at least from the private pay folks, is that, hey, I'm paying you in cash. You don't have to do any of the insurance stuff. You don't have to wait to get paid. You got 1.5% or 2% or whatever the debit card or credit card fee is, as opposed to the upwards of 30% that it costs you to charge. So you need to give me a discount as a result of that. I think that the pushback on that has been, at least from people that I've talked to in the hospital spaces, they said, well, we have to get paid 2 or 3 or 4 times Medicare, because Medicare's rates, we just can't do it. We can't do Medicare rates and survive. And I don't know if you know enough about kind of hospital finance, but can they survive on Medicare? I mean, can that be a reasonable price in which a hospital can survive off of?
So that's a myth that is perpetuated by hospital administrators, that they cannot get by on Medicare. There's not a lot of research done on this. So I have researched this. There's not a lot of research done that proves this one way or another. Mm-hmm. And if people know of research that's been done, please send it to me, because I have looked. I've talked to a lot of people about it. What the hospitals really need to do is get rid of the waste in the system and all the squandered healthcare dollars. They estimate that about 1/4 of all healthcare spending is wasted. So we spend about $4 trillion a year, and we're wasting about 1/4 of it. So rather than just say everybody needs to keep paying more, the system needs to improve its efficiency so that they can get by on less. And you do see analytics of Medicare cost reports where there are hospitals that are getting by on just Medicare, but many will say that they can't, and almost all of them will say they can't get by on Medicaid rates. So there is some truth to it, but there's a lot of wasted healthcare spending that's going on in hospitals that needs to be corrected. And it still doesn't make sense why you would assume that working people should pay more. Like, I remember sitting in a hospital CFO's office and talking to them about this very thing. And I asked them, how is it fair to make working people pay more? This cost shifting, again, this is the normalization of deviance.
Cost shifting, yeah.
Yeah. Let's not talk about cost shifting as if it's normal and what should be done. That's deviant behavior. So you're making some people pay 2 to 10 times more than others just because you say the other people don't pay you enough. How is that fair to the people who are being demanded to pay more? That isn't fair. And that's what the CFO said. She said, it's not fair. It doesn't make any sense, but it's just what we've always done. Mm-hmm. And so there are all these established norms, again, deviant norms in the healthcare system. And what I'm doing with my book and with my videos and with my newsletter is I'm pointing at these norms and I'm saying, I don't accept these. We should not accept these. Just because this is the norm and this is the way you've done it does not mean that it should continue. In fact, it needs to stop. I'll give you another example. We spend at about 2 times more per citizen for healthcare in the United States than almost any other developed nation around the world. Mm-hmm. So there are some that spend, no one spends close to us at all. And we are getting much, much less for our money. When you look at the number of uninsured people we have, the number of underinsured people we have, these other countries are spending half as much, and they're providing healthcare coverage to their entire population. Meanwhile, we have, say, 40 million uninsured and 40 more million who are underinsured, meaning they have high deductible health plans where they owe the first $2,000, $5,000, even $10,000 before the health plan even kicks in. So we pay twice as much. We have 80 million or more who are underinsured or uninsured. We're getting less for our money. And yet the assumption is that healthcare costs, they just have to keep rising. So again, the norm is healthcare costs keep going up. And by the way, they're projected to continue going higher and higher and higher and higher.
Yeah.
I don't accept that. If you look at all the studies about the wasted healthcare spending, about the inefficiencies, about the administrative bloat, about the unnecessary treatment that's provided over and over and over again.
Yes.
We need to stop these practices so we can actually bring down the cost of healthcare. People should be paying less and getting more, not paying more and getting less.
Yeah.
And so that's what we need to push for. And once you kind of see this, you go, oh, wow, like, so everything in the healthcare world is just upside down and backwards in terms of the way we expect things to be, you know, at least in terms of the financing and the pricing of things.
Yeah.
So once people realize that, again, it gives you that standing, that moral conviction, that backbone that you need to have the guts, because for some people it does, it takes a lot of courage to call them up and call them on their crap, basically, and say, hey, wait, this isn't going to be okay. We're going to have to get this corrected in a way that's fair.
Yeah. I mean, one of the things I love about your book, amongst many things, is you do make this process approachable. You know, it is something that pretty much everybody can do. You know, so we can walk through an example is, you know, you go to the ER, they stick you with a massive bill. You don't think it's fair. You know, you can go back to them and you can say, hey, listen, give me a fair and reasonable price. UCC 2-305 says, what is it called? An open price contract or something, right? Is that what it's called?
The open price term, yeah.
Open price term. You have to give me a fair and reasonable price, and, you know, see what they say, you know, and then say, hey, if you don't give me a fair and reasonable price, then I'm going to take you to small claims court. Which, by the way, I've seen in many small claims courts across the country, just legislative rules here, is small claims have gone up pretty significantly. It used to be $5,000. I think many are going to $10,000 or $20,000. I think Texas now is $20,000, which
$20,000. Yeah.
So most of the time you can sue them for the entire bill under the $20,000 limit. How hard is this? How hard is this to do, Marshall, with just, you know, a normal person, uninsured person who wants to do this? How difficult is this to do? Do I need an attorney involved? Can I do it myself? How hard is this?
So with small claims court, it's not logistically difficult, but it is stressful. It's anxiety inducing. It's more of an emotional burden, I think, for most people, because it's such a foreign thing to do. And unless you have, you know, everybody's got a different personality, you know. My personality, as you can probably tell, I mean, I'm a fighter type of a personality, right? I to me, standing up to bullies is something that I kind of get a rush out of that. So I kind of like it.
I can't tell. I can't tell.
Yeah. So I'm always up for that. Right. But most people, or many people, are not like me, right? They're more like, my wife is a very much of a peacekeeping type of a personality. For her, this would be something that would really cause her a lot of stress. She would not want to do it. But they have pinned the peacekeepers. They back them into a corner too financially. I mean, if you're getting hit with a bill for thousands of dollars, it's not fair or not accurate, and they're not correcting it, they've given you no choice. So whether you're a peacemaker or whether you're a fighter, you have to use the resources that you have at your disposal to protect yourself. And so logistically, it's actually quite simple to do. The courts all have brochures. They have clerks who can walk you through the process. They won't give you legal advice, but they will walk you through the process. And it's a matter of paying a filing fee, you know, $50, $40. You can do it all online. You write a very short, brief description of what your case is about. You really don't want to go into a lot of detail there. These are contract disputes, so that would be kind of the category it would fall in. They're violating an agreement with you to be fair and reasonable in their pricing. And what happens, though, when you file that case, so you pay $50, you take an hour or whatever it takes. You have to make sure it's served properly. And again, the court will have all the explanation about how to do this. So you might have to pay another small fee to get it served properly. What happens then is they are legally required to show up for that court date and defend themselves in small claims court. Now, if you followed the process that I lay out in my book and my videos, you've already priced out your bill. You've gotten an itemized bill. You've checked it to make sure that it's accurate. You can nail down how much you're being overcharged by looking again at hospital websites, by looking at the website fairhealthconsumer.org, the website healthcarebluebook.com is very helpful. So you can get kind of an estimate of what you should be paying, and then you can see what they're overcharging you. And then that chasm between those two is what your damages are. That's what you're trying to get the court to free you of. So you've done your homework already at this point, and it doesn't take that long to do that homework either. Again, I would estimate it takes less than an hour to do that. You have to know how to do it. You have to make the calls. You have to send some emails. You have to engage. You do have to engage, but it's not hard to do if you're motivated to do it and if you know what to do. And I show you what to do. So let's say you spent an hour to find out how much you're being overcharged. Let's say you spend another hour to file the claim. So you've taken 2 hours and you've invested about $100 to file your case and serve it. Now that hospital or that doctor or dentist or whoever it is, they probably in their case are going to want to hire an attorney to defend themselves. Attorneys per hour charge between $500 and $1,000 per hour. So if your claim is only for $500 or $1,000 or $2,000, it's really not worth their financial effort to defend the case. It's in their best interest to settle that case with you. And in almost every case where I've helped a patient do this or heard of a patient doing this, they settle the case before it goes to court. So you're not even thinking, I'm going to court, I'm going to have to stand in front of a judge. You're thinking, I really want to motivate them to settle this case so that we don't have to go to court. And in most cases, that's what happens. So they're spending $500 to $1,000 an hour to defend that. And then imagine they're going to have to show up in court and stand in front of an independent judge. Now, this is where it raises the stakes. If you lose in court, you're going to have to pay. If they lose in court, they're going to have to allow you not to pay. Sometimes a judge will say you don't have a claim until you've paid the bill because you can't show the damages. I've seen this both ways. So again, you don't quite know what that judge is going to do. Right. So that is where it's riskier for the patient as well. But you can always withdraw the case if you don't want to go to court. You can dismiss it and decide not to do it. And by the way, I should have mentioned before you file a case, like I mentioned that story of Don Jones. Don, I have a 30-day warning letter in my book and in my videos that people can adapt for their case, where you send that warning letter and say, hey, if you don't correct this, I'm going to sue you. So that's kind of the step that you take before. And oftentimes it'll get corrected at that stage too. So how hard is it? It's not that hard, but it is emotional. For anybody, it's emotional. It raises the stakes, but that's what our small claims court system exists for. And again, I love the United States. Our country has problems, but our country has some amazing things in it that let the little guy stand up for himself. And I love small claims court because it does just that.
Do you make an offer in that 30-day warning letter? Because I think I remember in your book, didn't somebody even write them a check and say, here's the check for, it was like a significantly less than that, and if you cash this check, then it means you've agreed to it, and they cash the check.
So that's a tactic that Al Lewis from Quizify talks about. Al is a Harvard Law School trained attorney, and Al says, write your amount that you're agreeing to pay right on the back of your check. Cashing this check is considered acceptance of payment in full. Yeah. And then have the billing department just cash that check. And then what Al says is that does give you more grounds in court to say, look, I sent them the payment and I said that if they accepted this, it was paid in full, and they cashed the check. So therefore I'm paid in full. Yeah. That's an Al Lewis method.
I love that. I love all these little tricks. Again, Marshall's book is Never Pay the First Bill. You also have the Allen Health Academy, which is a series of videos that help consumers like me and you navigate some of this. What's the latest on the Allen Health Academy? What can we expect if we go over there?
I took the book and I had some consultants who work with employer-sponsored plans asked me to turn it into a series of health literacy videos. So basically, I've taken the book and I've turned it into a video curriculum. And people can look that up. It's at allenhealthacademy.com. And it's 16 videos. The videos are about 5 minutes each. It's really the same content in a book, but the advantage of it is for some people it'll be more engaging than if they read the book. People might be visual learners. And also I have show notes with each video. So the videos talk about each one of these different tactics. And then I have show notes with links to other resources that might help people as they're doing whatever the video is talking about. And so the other thing that's great about the videos, they're just easier to update with additional resources and things like that. So my vision here is to equip and empower every working American to navigate the healthcare system, to be able to protect themselves when they're being overcharged or when their insurance company's denying payment, or showing them how to use financial assistance policies at hospitals. I think these are maybe the most underutilized resource that can just forgive your bills entirely. Nonprofit hospitals are required to provide financial assistance, required by the IRS. And so especially anybody who's on the lower income level, but not always so low. I mean, 200 to 400% of the federal poverty limit. So especially if you have a family, if you have kids, anybody in that kind of middle income range can probably qualify for some forgiveness of their hospital bills. So if you go to the hospital, the first thing you should do is look to see if the hospital financial assistance policy qualifies you for forgiveness of the bill or partial reduction in the bill. And a lot of these are very generous policies. I've seen policies at hospitals where people who make six figures can have a 90% reduction in their bill, depending on how many other bills they have, how big their family is, things like that. So again, if people know that up front, well, then they're not even going to be hitting those bills because they can use the financial assistance policies. And I also refer people to an organization called $4. They're at $4.org, and all your members should be using $4. They're a charity, and they will actually file the hospital financial assistance paperwork for you. They'll follow up on it, and they will get it closed out for you. And they're incredibly successful at this. They are really number one when it comes to using financial assistance policies. And so, check out $4 if you have a hospital bill and see if they can help you out.
Yeah. What is your answer to the folks that say, oh, well, you should pay something because what you're doing is you're just, taking this away from the hospitals. The hospitals need some money to survive. And so you're getting free care. You need to pay for at least some of this. What is your kind of response to that?
Well, my response to that would be that hospitals that are nonprofit are saving millions of dollars a year in taxes because of their nonprofit status. And the law says that in return, they're expected to provide a community benefit to patients. And so this is part of their fulfillment of their nonprofit mission, being a benefit to the community. So no, I don't think that people need to just pay something. That hospital owes this to the community. They're saving so much in taxes by being nonprofit. This is what they're required to do as part of their community benefit. And so people should not feel bad about applying for financial assistance or feel like they're somehow morally doing something that they shouldn't be doing. This is the hospitals owe this to their communities. They are saving so much money by not paying taxes that this is what they are obligated under the law to do in return. So we just need to know about it and then take advantage of it. So this problem just keeps getting worse. And so we have to have multiple approaches. I also have a newsletter. My newsletter is free, so I encourage people to subscribe. And that's at marshallallen.substack.com.
Great.
And the newsletter, I just call these victory stories. Every 2 weeks, I publish more stories of individual people who fought the system and won. I mean, this is David beats Goliath every time. And it's important to share these things because we want to normalize this behavior and show people, give them the information they need and also the inspiration they need, because it can feel very discouraging. It can feel overwhelming. And I know how that feels. I mean, it's new it's complicated. You got to read the fine print. You have
Sure.
to look things up. It takes some engagement and some effort. And so what I want to try and encourage people with is you can get equipped, you can get empowered. And when you do, it brings about a lot of satisfaction. And also you protect your money and your family's money going forward for years, like the story of Don Jones, right? I mean, 2 years in a row, he got hit with the same problem. If we roll over and just pay these unreasonable bills or go get overpriced healthcare, we're just validating their dysfunction.
Sure.
And we're enabling it. And so I look at this sometimes like, what can one person do to change the system? And sometimes people say, oh, well, the system's never going to change because, most people are never going to do that. And so my response there is I'm like, okay, let's say there's 200 million Americans getting screwed in this particular way. Let's just say that 1% of them pushes back. That's 2 million people. If 2 million people demanded an itemized bill, priced out the bill, made sure it's accurate, made sure it's fair, pushed back when it's not, we would create so much hassle for them to continue with this nonsense that I do think it would bring about a change. So I'm really trying to bring about a movement of change at the grassroots, at the level of the people who are being harmed, to protect them and also to change these norms so that we stand up and say, these norms are not okay.
Yeah. And again, the book has inspired us, at CrowdHealth, because, what we will do, a service that we do provide, is we'll take a look at those itemized bills. We'll take a look and make sure that the CPT codes that they're using are the right CPT codes.
Yep.
We also have a team of attorneys who will help you walk through, fighting the hospital if you need to. So if you're not a fighter, if you're a flighter, that's okay. Let us fight for you. Like I said, we got a team who, these attorneys can help you walk through that. And what we have found is if you are willing to put on some boxing gloves or even tell people that you're going to put on some boxing gloves, they typically will back down. It is not in their best interest, whether financially, PR, to fight people over medical bills. This is not something that they want to do. And so they are taking advantage of you because they know that you don't want to put on the boxing gloves.
Right.
And in reality, they don't want to put on the boxing gloves either. So, any if you're a member of CrowdHealth watching this, please call your care advocate if you have, this type of situation come up, because we do have the resources to help you do this. And we're going to push back. I mean, somebody's got to push back and do this work. So, Marshall, thank you.
I love what you're doing there at CrowdHealth. You guys are on the cutting edge of bringing about change and also protecting people's pocketbooks. And I love that. And even all your members are a tremendous army that can rise up to stand up against these wrongs. And we're doing it, when we do it, we're doing it for ourselves, and also we're doing it for each other, because the more all of us collectively say this is not okay, we're going to save ourselves money, and then we're also going to be protecting the money of other people who are also getting taken advantage of.
Yeah, amen. Marshall, thanks for joining us. We really appreciate it.
My pleasure. Thanks for having me here.
This has been the Healthcare Liberty Lab. Thank you to our listeners and our sponsor, CrowdHealth, for making this possible. Be sure to subscribe wherever you listen to your podcast, be it Substack, YouTube, Spotify, Apple, or somewhere else. We're glad to have you with us on this mission to rethink healthcare together.